Hey guys, Frank Cawley back here, and I'm behind the scenes on this video, so no, you're not going crazy, but we're going to talk about a very common problem or diagnosis that we see in our clinic with people with a particular foot condition. This condition is known as plantar fasciitis. If you've ever suffered from this or been told you have it or think that you have it, you will definitely know what I'm talking about. So what we're looking at here is a anatomical picture of the bottom of the foot. And what you can see here, that white structure on the bottom is the plantar fascia. It goes from the heel bone at its beginning and then ends where it ties into all of your toes. So if you look at it, it kind of looks to me like a little fan that you would use to fan yourself if it was hot out. So anyway, the plantar fascia is a ligament, which means it connects from bone to bone. It adds support to the arch of your foot and basically helps maintain that position. And basically what happens when we step or walk, it will spring up and down in a normal person without any issues. Now, some of the common problems we see that lead to, or people that suffer from plantar fasciitis include runners, people who stand for prolonged durations, such as factory workers or with jobs that entail prolonged standing, people who wear particularly poor shoe wear or improper shoe wear for long durations. This goes for all you flip-flop wearers out there. They are terrible for your feet. Even though they might look stylish, they are not very good for people with plantar fasciitis problems. They also are going to go along with people who may have a high or low arch can affect the plantar fascia. That is another issue. And lastly, plantar fasciitis can be induced by trauma to the heel area or somewhere on the bottom of the foot. Now, the most common area for the heel pain to occur for plantar fascia is right in the heel, right on the bottom of the bottom side of that heel, And the easiest way to check and see if you are a plantar fasciitis sufferer is very simple. We do two different tests. The first test is known as the first step test. So at the second you wake up and go to get out of bed, whether it's the middle of the night or first thing in the morning, and you take that first step and you have sharp shooting, agonizing, severe pain in the bottom of that heel, and it feels like you're stepping on a pin, you definitely have plantar fasciitis. Other test that we do is called the hot spot test. If you take your tip of your thumb and you're kind of checking around that heel area over here, and you're looking for some spot or some area that you can find, and if you push in on that aggressively with your thumb and you want to jump off the chair or the bed, you can pretty well be rest assured that you are suffering from plantar fasciitis. So the other question is, people might say, well, what the heck can I do for this? I don't want to live with this. And there's a bunch of home remedies. Some people try rolling their foot on a cold water bottle. Some people try stretching it. Some people will try rubbing it. There are a lot of home remedies that you can do and that we can give you tips on. So if you're looking for answers, I always encourage people to try PT first, because your other options for this are, of course, going on medications, which has plenty of side effects. The other option is receiving an injection, which for those of you who have had one or don't want one or are thinking about one, they can be quite painful. And lastly is surgical intervention to try to release that fascia and ease up some of the tension or tightness. So I always encourage people to think of physical therapy first. So this is a very common problem that we see in the clinic, plantar fasciitis. If you're suffering from that, we're happy to help you and give you answers on that. And in our next video, we're going to share another common foot or ankle dysfunction that affects a lot of people and gives a lot of pain or problems. So please stay tuned to our next video, and we're happy to share that with you. Thanks.